small pockets of fat can be dissolved. It's called Mesotherapy spot fat reduction. Hi, I'm Dr. Michael Cutler at San Diego Integrative Medicine and Spa, and I'm excited to tell you about a treatment that's working, and it's called mesotherapy. Now that's a phrase, a word that doesn't really mean anything specific, but mesotherapy using deoxycholic acid, which is the same ingredient in Kybella from Allergan. We mix it here from a compounding pharmacy with phosphatidylcholine that makes it fat soluble even better. And this deoxycholic acid, we'll tell you what it does in just a minute, can be injected into small areas such as the double chin or even the puffy little fat areas that can accumulate on the lower jaw or on the sides, or even in the under eye bags or under the arm. Okay, small areas, we're talking some small pockets on the back or in the flanks, and it does reduce the fat. And how's it do it? It chops it up. It's an enzyme, basically enzymatic reaction. Think of it how it's just digesting the fat. Now, where does deoxycholic acid come from? Actually derived from something we all have. Deoxycholic acid is what's in the biliary fluid. So bile is this fluid that's excreted into the intestinal tract when we eat a large fatty meal. That's why we get gallstones sometimes. They just get stuck, and that's another story. But this same material is in our body, and it's specific for digesting fat. So when it's purified, extracted, and put into a sterile vial that I can use to inject you with a tiny little needle into certain areas, you can imagine there's a digestion effect that's going on. Now, what does it look like to have spot fat reduction? Let's just say the most common area in the submental or the double chin area. Okay, that can be liposuction if it's big enough, but if it's not big, how about just using small injections? What I do. So I use a 32 gauge or a 33 gauge needle in a syringe to inject this clear, greasy kind of fluid. That's deoxycholic acid with phosphatidylcholine mixture, and it's injected right into the area. And it takes about 5 minutes. You start to get this redness and a little bit of swelling, and within a few hours you get a little bit more puffiness in the area that's injected. And over the next several days to maybe even up to 2 weeks, you'll have this puffy redness that's going down gradually as your body goes through this inflammation reaction, like a swollen ankle, and it's digesting the fat, and then your body will take that digested material and get rid of it through the lymphatics. So it's going to shrink back over a period of maybe 5 or 6 more weeks after the injection. So think of like your ankle sprain. Swells up. You think, oh, I don't like this swelling. Well, we don't like swelling, but we do like the inflammatory reaction. The inflammation is the migration of all these cells that are preparing for proper healing, right? I have to say, if you didn't get a swollen ankle and you got a bad ankle injury, you could be in bad trouble. That means you are on some immunosuppressant drug, or your body's not reacting. You're not going to heal it properly. So the inflammation is what you want to have after the injection. You expect it to get red and puffy and a bit painful for maybe 2-3 days, but not so bad that you need to take some pain reliever necessarily. You would want to avoid tapping on it for the first few days, possibly, but you don't need to take ibuprofen, for example, as an anti-inflammatory. We want the inflammation to be working that way. But as your body will take that digested fat material and shrink it down as it gets rid of it through the lymphatics and the ways our body naturally clears out swelling, just like your ankle. Now this area is going to shrink back, and normally it's a 1, 2, possibly 3 treatments. For example, the tear bag and under eye bags that accumulate, that accentuates the tear trough. A lot of people come in, they have these big bags under there, and they have these tear troughs and say, I want filler. And I say, oh no, we don't want to put filler in there because filler will just fill that in. You still have the big bulge under there. We need to try to shrink back that fat very carefully with a tiny 33 gauge. I do typically 5 little injection points there, and it swells up. Yes, you have to be ready for some social downtime. This is one of those for sure. You're not going to look your best for several days, but when it goes back down, now you have a permanent reduction in the under eye bag. So typically 3 treatments will be needed to really get that down significantly, where maybe a little tear trough filler or PR, platelet-rich fibrin matrix, could be placed in there to help fill in the deficit so that you don't see those tear troughs, or you don't. And now the under eye bag's gone, so it's a great procedure. Now the same in other areas, but the thing is, it's not painful to have injected. It's just a bit of pain, emotional pain possibly from the social downtime from swelling, especially if it's on your face. But I like to have patients do 3 treatments maybe up to 6 if needed, and each treatment is typically 6 weeks apart. So that's mesotherapy spot fat reduction. If you have questions, please leave them below. We'd have to respond, and we hope that you'll subscribe to our channel.